And a very good Sunday morning to you. Welcome to Local Issues, Real People, a public affairs broadcast from Piedmont Communications. I'm your host, J.D. Slade, and Local Issues, Real People is brought to you every week by Rappahannock Electric Cooperative. REC, reliable, affordable, and dedicated to community. My guest this morning is from Fauquier Hospital, and it's like we're going to have a good time talking about, well, his specialty. He is Dr. Barry Aron. And Dr. Aron, welcome to Local Issues, Real People.
Good morning.
Okay, so now what is your area of specialty?
Certainly. I'm a OBGYN, general obstetrician gynecologist, so a little bit of everything in that regard, we say. Of course, delivering babies, but also taking care of women through all different aspects of their life, from adolescents to older women, and doing surgery as well.
And you're not new at this. I mean, you've been doing this for quite a while.
Yeah, 28 years.
You hear how he says, yeah, 28 years.
I've become a senior guy. Somehow that happened. I don't know how.
Well, let me ask you, Dr. Aron.
I'm the young guy.
Let me ask you the basic question, all right? We'll see what your memory looks like. How many babies have you delivered?
Yeah, so that question comes up all the time, Diddy, and I try to estimate it through the years and the number of years I've been doing it. So seeing somewhere upwards of about 8,000.
Wow, you have brought a lot of life into the world.
Yes, I'm blessed that way.
Let me ask you, what is one of your favorite mom and baby memories as a doctor?
Sure. Well, of course, I've got a number of them. I think probably the most gratifying has been very lucky that I've had the ability to deliver some babies to some women that unfortunately haven't had the best outcomes before that. So when you've been through the worst times with people, it's really a blessing when you get to be through the best times with them too. So I think those are probably my fondest memories.
You have a job that, again, a lot of people do not understand, because you have got to not only be a caregiver, you've got to be a psychiatrist, you've got to be a physician, you've got to be a friend. Again, do you recommend expecting mothers do light exercising while they're pregnant? Because that is a question that has come up a lot.
Yes, I do. And I think there's been a lot of data, more and more through time, showing the benefits of women exercising in pregnancy, even some vigorous exercise. Of course, I don't recommend women decide to start training for that Ironman triathlon I always wanted to do. But if they were exercising, I think it's great. I've had a patient run a marathon during her pregnancy. But she had been working for that for a long time. But I have a lot of women who are very active, and many women this day are more active than men are, frankly. So exercising during pregnancy, I think it's a great idea.
You know, Dr. Aron, what we haven't talked about is exactly where you see your patients.
Yeah, so I'm employed through Fauquier Hospital, and we have two locations. We have the one location right here in Warrington that's just on the hospital property. Of course, that makes it most advantageous when you've got a woman in labor. And then our other office is in Gainesville area, Lake Manassas, up the Lake Manassas Drive there.
You know, everybody's got questions about, why is it encouraged that patients rotate through their office procedures?
Sure.
And providers?
Well, in our practice, we've got two physicians, myself and Dr. Mishra. We also have two midwives, Monica and Kathleen. And we take turns at nighttime on call, so we try to make sure that it's always one of the four of us, at least, that are the what we call the first call person. When the midwives are on, there's always a physician backup. So either one of the two of us is generally their backup, or sometimes we'll use another doctor from the area who will help us out too. So we want the women to get to know their provider so they'll feel comfortable with who's there delivering their baby.
You know, I know that the University of Virginia is a teaching hospital, but what kind of educational classes does Fauquier offer?
Sure. Well, we have online birthing classes. Kind of COVID threw a whole big wrench and all that stuff with doing inpatient and in-person education. So we have a service. There's a company called Birthly, BIRTHLY, that we are able to offer to our patients so they can register online, and it's interactive, but also on their own schedule. So that's really worked out well. And they offer birthing classes and breastfeeding classes, which have been really helpful. And then, of course, we try to do as much education as we can during our visits in the office, and then once the women are in the hospital, between the nurses and our lactation consultant and ourselves, we try to do our best to help educate them as much as we can.
Dr. Aron, I want to ask you, go off the script a little bit, because, we've had this problem with a baby formula shortage, and I happen to know that you do have lactation classes. Do you recommend those for pregnant women?
Yeah, I think they're very helpful. And I think they also work, as I said earlier, working with the lactation consultant after the woman delivers, which is actually trying, having her right there. We also, a couple of our pediatrician offices offer a lactation specialist within their office, which is really helpful to our patients as well.
All right, let me ask you one more question here. Outside of delivering babies, what type of surgeries do you perform regularly?
Sure. So, kind of a whole gamut of surgery. I personally really like the minimally invasive surgery and do a lot of stuff through the laparoscope with the little incisions in the belly, and do both hysterectomies, removing fallopian tubes, taking care of ovarian cysts, treating endometriosis. We also do hysteroscopic surgery, which is the scope going through the cervix into the uterus. And through that, we can sometimes remove polyps and fibroids, and just making sure there's no other problems that are there. Kind of a up-to-date version of the old DNC that used to be done.
My guest this morning on Local Issues Real People is Dr. Barry Aron from Fauquier Hospital. Dr. Aron, let me ask you, you've been doing this a long time. Again, how have things changed from when you started delivering babies to now?
Well, it's changed quite a bit. I think back to when I was first in my training, so that was about 32 years ago. In those days, we used to have moms deliver in a delivery room. Nowadays, moms labor and deliver and recover all in the same room, with much less formality, for lack of a better term, much more relaxed. I've learned through the years to have women pushing in a lot of different positions, and one of the great benefits to working with midwives, they've helped educate me along the way, and some of the other techniques. I think that's been a big part of it. I think through the years, women have a much more involved role in their healthcare than we once had way back when I started in my career, when it was kind of more dictated from the mountain, so to speak. And now we're partners in their healthcare, and we try to involve in shared decision making. So I think that's been a big improvement. I think also from a medical and surgical standpoint, we have a lot more options to offer women, particularly as women are starting to approach menopause and maybe have some bleeding problems and issues. And back in the day, as I like to say, we didn't have much to offer women as far as alternatives to, from a medication standpoint and a surgical standpoint. It kind of felt like they had to have hysterectomy, but nowadays we can do different medical therapies and use IUDs, as well as less invasive surgery like endometrial ablations and things like that. So I think that's been a big improvement.
And the other question...
Of course, lastly...
Go ahead. I'm sorry.
I was going to say the technology has just changed so much. Back when I was first in my training, the idea of the laparoscopically assisted vaginal hysterectomy came on, and now we do the total laparoscopic hysterectomies, where we do everything through the small minimal ports. And then, of course, the robots come along, and that's changed things as well.
Do you use many robots in your work?
Right now, I personally do not use the robot. I've been kind of partially because of my years of experience and stuff, I've gotten very comfortable with laparoscope and feel like I personally can do much of everything through the laparoscope. There are, but we do use it here at our hospital, and surgeons, and then the other gynecologist in my practice, she actually feels more comfortable with the robot than the laparoscope. So it kind of gives people what we feel comfortable and we feel like it's in the best interest for our patient.
Well, I've been doing this a long time, and it's like, in having done this a long time, I've seen the progress of how my career has gone and how the technology has changed. So I know it's got to be just a world apart for all the technology advances that you get to see almost every day.
Yeah, which is one of the fun things about what I do. It's always kind of a chance to learn and learn new things and keep it changing. But it still always comes down to the the patients and the doctors, and I really enjoy. One of the things I really like about OBGYN is it's just, as you kind of mentioned earlier, the relationships with patients. Where I've only been this area for 4 years. I was in Maryland for about 24 years before that, and really kind of watched these families, some of these young girls become women and have their kids and then deliver their kids, and that's really a kind of a great joy in my life.
At what point do you think that a woman, once she finds out that she is expecting, when should she really start getting serious about getting ready for the delivery?
Well, of course, we like to start the prenatal care as soon as possible. We usually like to see our patients at about 8 to 9 weeks of pregnancy. It's a good time to confirm that everything is okay, that we've got just one baby in there, the heartbeat. And then, of course, our prenatal care starts at that point, and we usually see women about every 4 weeks through much of the pregnancy till the third trimester, and then third trimester every couple weeks till the end of pregnancy, then it's every week. But I don't think it's ever too early to start thinking about her pregnancy. I mean, some people say that the best prenatal visit is one before you're even pregnant, because as women get older, some women have other medical problems or on some medication, so it's always a great time to talk about their pregnancy even before they're pregnant to make sure they're as healthy as possible.
I have to tell you, doctor, I as a man, I'm a typical man. I have no modesty because I've been in the hospital, but women go through ideal. They're poked and prodded and looked at and studied. If men had to go through that, I don't think we'd have a very, very healthy society.
Well, I think if it was up to men to have babies, the population would have died out a long time ago.
That's all she wrote. I saw both my children born. I saw them both, and it's like, and I've always said that all men should have to see exactly what happens from start to finish so that they can know what they did.
Absolutely.
So what's the best part of your job, my friend?
Best part of my job, I think it's just, watching families grow, I think is what I would say if I had to put it in one thing. I mean, I think it's from, like I said, some of the patients I've been fortunate enough to see from birth through their life, watching them have children and watching them, just grow up, and it's pretty rewarding. I mean, I've really had great opportunity to see a lot of great women from young girls, and it really makes me proud to be part of their lives.
As someone who has been doing this for some time, how does one get started in the idea of being an OBGYN?
Well, I get asked that question all the time. How did you decide what this specialty was going to be? And I'll be honest with you, when I went to medical school, my original plan, I was going to be a pediatrician. But then when you're in medical school, at least back in those days, and I don't think it's changed that much, you rotate through all the different specialties, and when you're in these different specialties, you get a chance to see what it's really like to truly be in that profession. Because it's often a lot different than what we think. I found out during pediatrics that I was sicker than I ever was in my life before, so I figured that wasn't going to work for me. But one of the things I liked about OB was it really had all kinds of different aspects. So from the general kind of family practice kind of aspect where there's women, just doing their yearly exams and health and questions and keeping healthy and helping, from a preventive medicine to doing surgery. And I like doing surgery, but I didn't really think I wanted to spend all my time in the operating room. And then the deliveries, of course, you routinely get to be in the biggest moment in people's lives, but also it's a little bit like the emergency room. You just kind of never know what's going to happen and when it's going to happen. So it kind of gets your adrenaline pumping there too.
You have got a very interesting perspective because you actually get to see life begin. What is that like?
It's amazing. It never ceases to amaze me, just the beauty of it all. And I always say like that, just hearing that heartbeat and just looking at the faces of people, and then from when we actually do the delivery and just seeing that first look and the immediate love between a mother and her baby, it's really a blessing to be able to be part of that.
I got to tell you, Doc, people who are listening, ladies that are listening, I can bet you the tissues are already starting to come out. Childbirth is a beautiful thing. It really is, but it is also a very complicated thing. And sometimes it doesn't go exactly as planned, does it?
No, unfortunately not. I was alluding to that before. Every so often, horrible things still do happen. It's a very humbling profession that way. Sometimes, despite all our best efforts, some of the worst things can happen. And then there's also just the delivery. I mean, everybody comes into pregnancy, or at least the vast majority of women, hoping for a nice, easy vaginal delivery. And sometimes that just doesn't work out that way. And I always try to tell women that the goal is to get them through it healthy and have a healthy baby. And sometimes a C-section is the only way to make that happen. And that's not a defeat. Still, the goal was to get them both through it safely.
I knew the OBGYNs for both my children, and I got to tell you, you guys just have a standard class because you all got the very same calm. And I know that your nerves have got to be rattling at 100 miles an hour, but you've got to put on that calm face so that you can be calm for the patient. That's got to be difficult for you sometimes.
100%. I tell women that all the time. It's okay for them to be nervous as long as I'm not. So I always try to, if I can be calm and keep it calm and keep it calm as our team, because it's not just me. You know, it's a team of the nurses and sometimes an anesthesia provider, sometimes a pediatrician, and we all have to kind of work together to do the best thing for our patients and help keep them relaxed and feel comfortable as much as possible and help keep them calm.
Fauquier Hospital has gotten a great reputation for their care, and now particularly with care for moms and infant babies. You've got to be proud of that, the fact that Fauquier Hospital is recognized for that particular aspect.
Absolutely. I mean, it's the biggest point in most people's lives, and it's usually the first involvement most people have with a hospital is having a baby. So trying to make that experience as good as possible and, such a wonderful, positive experience usually gets things off in a good start.
You've got some really great people that are working around you, and Fauquier Hospital is making sure that they keep up to the moment. What, if there's one thing that you could have or could do, what would it be? I'm giving you your magic wand for one thing.
One thing, if I had one magic thing, be more of us. More providers. I mean, we're just short. I mean, every place in healthcare is having challenges between the physicians and nurses, and a lot of people have left medicine over the last several years. So just having more, I'd love to have more docs and midwives here with me and more nurses here. That if I had my magic wand.
I have I have a very close relationship with the medical profession. When I went to college, I was going to be a doctor, but I fainted at an autopsy, so I had to change the major. My daughter, though, is a traveling nurse supervisor, and so as a result, she gets to see a lot, and she gets to help a lot in birthing children too. And she says that is just the most rewarding thing that she's ever done. Once that baby comes out and you hear that cry and you hand it to the mom, you just don't see a more beautiful moment.
It's pretty special. It's a real blessing to be able to be on a regular part the biggest moment of most people's lives. It's really.
I asked you earlier how many babies you had delivered, and you basically pretty much guesstimated about 8,000. That is a lot of joy that you have provided this world. I mean, the whole idea of being here is making sure that you leave the planet a little better than when you got here. And I'd say you've done 100%. Your job there, sir.
Well, thank you.
You say that you need help. What kind of help are you guys looking for? Maybe we've got somebody listening who can fill the bill.
Sure. We're really lucky to have some great nurses, but we can always use more of them. And like you said, I mean, your daughter traveling, and there's a lot of travel nurses, and we'd love to have the nurses from our community that can come here and work and be part of the community. And we are looking for another midwife and another physician. So if anybody thinks this is a great town to work, a great area to work, I mean, there's a lot of just it's such a beautiful place to live, and so many nice families that we're really lucky to get to work with on a regular basis.
And when you take a look at the big picture, besides the joy that you're bringing to other people, that's self-fulfillment. I mean, I just cannot imagine anything that would be more fulfilling than knowing that you had a part in bringing life to the planet.
Absolutely. As you said earlier, nobody's looking at your bank account when you die, and nobody's looking at anything else. But when you can feel like you left the world a better place than you found it, or at least helped as much as you could, that's what you want to leave behind.
Exactly. I enjoy this conversation because, like I say, I can hear the compassion in your voice, and I think that takes a great deal of compassion, because not only do you have to be the one that's smiling when things go right, you've also got to be the one who's got to deliver the bad news. And again, it's not always good news you deliver. How do you handle
100%.
that?
Yeah, it's challenging, and it's just, like you said, just people being real and being honest and being compassionate. I mean, I've had the, I guess, misfortune, but in some ways it's a fortune to cry with some of my patients through the years, but also the blessing of being there for the good times. And I've always said, actually, some of the most appreciative patients I've ever had in my career have been the ones when things didn't go well, and they just appreciated that someone cared and just cared about them, and that's all we can try to do.
Again, like I say, it is a job that is not for everyone, because everyone can't handle it. And those people who do get those degrees and become doctors, they are special people indeed, because they've had to go through all kinds of emotional ups and downs and physical ups and downs, and have to not only be sympathetic but empathetic as well.
Understand.
Dr. Aron,
yeah,
go ahead.
I mean, that's a big part of our training. I was really fortunate. My grandfather was an old-fashioned GP, and when I got into medical school, he gave me some really good advice about just being good. Actually, the first thing he said to me was, be good to your nurses, because that's really who's taking care of your patients most of the time. And then also just being caring about people. I've always tried to follow that.
And I know many doctors. I have quite a medical team myself, but it's like, the thing of it is that they all have something in common. They're right there. They feel with you. They feel for you. They try to make sure that they make it the best possible way for you so that you can get through whatever you're going through. And so far, knock on wood, I have yet to have had a bad experience with any medical doctor. Of course, OBGYN, you're dealing with a whole different set of circumstances there. But like I say, the fact is that there are a lot of happy women, a lot of happy parents out there thanks to you.
Well, thanks.
Now, if I have to give you one more shot here to talk about anything that you'd like to about your business, your position as a physician, and Fauquier Hospital.
Well, just I guess that we're try our best here to be part of the community and to be a hospital that the community can be proud of. And we do our best to kind of bring healthcare to our families in the area, and sometimes from outside the area, and that we just want you to help grow with us, and anything we can do to make your lives better, let us know.
Again, Fauquier Hospital, one of the great hospitals in this country, and I want to thank Dr. Barry Aron for joining me and talking about basically the start of life, because you guys get to see it from both ends, birth to death. It's like, in your end of it is the big happy side of it. And so, again, I certainly hope that you have continued success, Dr. Aron, and thank you very much for joining me on the program.
Well, thank you very much for your time. Have a wonderful day.
Thank you. My guest has been Dr. Barry Aron from Fauquier Hospital. Again, Fauquier Hospital, you are looking for a new career? Hey, this might be one way to get started. Just check them out. That is Local Issues, Real People for this week, brought to you by Rappahannock Electric Cooperative. REC, reliable, affordable, and dedicated to community. I'm J.D. Slade.
Adopt US Kids presents What to Expect When You're Expecting. A teenager. Learning the lingo.
Today I'm going to help parents translate teen slang. Now, when a teen says something is on fleek, it's exactly like saying, that's rad. It simply means that something is awesome or cool. Another one is totes. It's exactly like saying, totally, just shorter. As in, I totes love going to the mall with Becca. Another word you might hear is jelly. Jelly is a shorter, better way to say jealous. As in, Chloe, I am like so jelly of your unicorn phone case.
You don't have to speak teen to be a perfect parent. Thousands of teens in foster care will think you're, rad just the same. To learn more, visit adoptuskids.org. A public service announcement brought to you by the U.S. Department of Health and Human Services, Adopt U.S. Kids, and the Ad Council.
This is the story of a very special woman. In a matter of seconds, she turned herself into a great mathematician or an entrepreneur. Her knowledge was limitless and still is. She could also make monsters disappear, especially those that lurked in the shadows under the bed. Once, this woman put back together a teenage girl's broken heart, which had been shattered in 1,000 pieces, just by giving her a bear hug. She masqueraded as a regular person at work, but as a superhero at home. Everyone knows her as Gabriella. I still call her Mom.
Your hero needs you now, and AARP is here to help. Find the care guides you need to help, complete with tips and resources at aarp.org/caregiving. A public service announcement brought to you by AARP and the Ad Council.
Don't you wish your life came with a warning app?
Stop. That dog does not want to be petted.
Just a little heads up before something bad happens.
Move your coffee cup away from your computer.
Oh, no.
So you can have more control.
Stop. You're texting your boss by mistake.
Uh-oh. Well, life doesn't always give you time to change the outcome, but prediabetes does. With early diagnosis and a few healthy changes like managing your weight, getting active, stopping smoking, and eating healthier, you can stop prediabetes before it leads to type 2 diabetes. It's easy to learn your risk. Take the 1-minute test today at doihaveprediabetes.org.
Warning. The cap is loose on that ketchup.
Ugh. Don't wait. You have the power to change the outcome. Visit doihaveprediabetes.org today. That's doihaveprediabetes.org. Brought to you by the Ad Council and its prediabetes awareness partners.
The possibility of lung cancer can be pretty scary, especially if you're one of approximately 8 million current or former smokers at high risk. That's why SaveByTheScan.org wants you to know that now there's a breakthrough low-dose CT scan that can detect lung cancer early, and it only takes 60 seconds. You stop smoking, now start screening. For an easy quiz to see if you're eligible, visit SaveByTheScan.org. It could save your life. SaveByTheScan.org is brought to you by the American Lung Association's Lung Force Initiative and the Ad Council.
Hey, son. How are you feeling?
I'm fine, Pops.
What's on your mind?
I can't explain it. Navigating without a compass, eyes waiting, started to wonder. Metamorphosis, the loss of who you thought you was.
When your kid can't find the language, help them find the lyrics. Listen to the Sound It Out album and get tips and tools to start a conversation at sounditouttogether.org. Brought to you by Ad Council and Pivotal Ventures.
Wake up and text. Text and eat. Text and catch the bus. Text and miss your stop. Wait. Text and be late to work.
Sorry, I'm late.
Text and work. Text and pretend to work. Text and act surprised when someone calls you out for not working.
Who, me?
Text and meet up with a friend you haven't seen in forever.
Hi.
Oh, hey.
Text and complain that they're on their phone the whole time. Text and listen to them complain that you're on your phone the whole time. Text and whatever. But when you get behind the wheel, give your phone to a passenger. Put it in the glove box. Just don't text and drive. Visit StopTextsStopWrecks.org. A public service announcement brought to you by the National Highway Traffic Safety Administration and the Ad Council.